Hello, everyone. Listen, I thought it would be really important for us as a church to address what's happening in the world with COVID and this pandemic. Many times, the church's approach is let's be real spiritual or let's be silent, and neither of those sometimes are accurate. So, what I wanted to do is have a conversation with a medical professional so that we could talk about this virus and what it is. So today with me is our family's primary care doctor, Hutton. He founded and started the Mulberry Clinic here in Spring Hill. And my wife and my children, we look to him for his gift and his profession as a medical doctor. And so I didn't want to get out of the wrong seat. The virus is not a theological thing. It's a medical thing. And so we wanted to have a conversation with someone who knows what they're talking about. This is the person that I look to for that. I also know that many of you, most of you have a doctor, a primary care doctor, that you should follow their counsel, follow their advice, do what they say as it relates to what you believe about what's happening. But I wanted to have a conversation around this and ask someone who can speak into it, who has the authority to do that. So thank you for being with us today.
Thanks for having me. Good to be here.
I wanted to start with the question, what does COVID do? I mean, can you just from a medical standpoint explain what happens and what it does in the body?
Sure, that's a good starting point,
Okay.
I think. So COVID is an acronym for coronavirus essentially, and the common cold has many causes. So there are several different viruses. Adenovirus, rhinovirus, that cause the common cold.
Gotcha.
Coronavirus is a family of viruses that cause the common cold. So there's many kinds of coronavirus. It's a group, kind of an umbrella of viruses. Okay. This one has been dubbed COVID-19, and there, SARS-CoV-2 is another name for it. And so a coronavirus essentially is a pretty common virus. It's found, coronavirus family is found everywhere. I mean, you could just randomly sample, a building, a surface, a play area, a school, anything, and probably find some evidence of coronavirus, dead or alive, there.
Wow.
So COVID-19 is a particular, you've probably heard it called novel coronavirus. So it's a newly identified virus, identified in 2019, thus the 19 designation. And so it is a particular virus from the class of coronavirus associated with common cold, upper respiratory infection. So what we look at is the symptoms, or the way that your body responds to the virus. So our body's always interacting with germs, bacteria, viruses as we sort of go about our day-to-day. And when we have a properly functioning immune system, and the amount of virus or the type of virus is easily dealt with by our body, in most cases we have mild or very few symptoms.
Gotcha.
Many people get several colds a year, and it's not that they get several viruses a year. They get, if we monitored every germ that came in and out of your body, it would just be hundreds of thousands, if not millions, a day. We just don't have symptoms to those in many cases. So the reason that this one has become important is because it's novel, meaning worldwide we think not many people have been exposed to this virus in the past and don't have much immunity to it. And in many cases, the first time we encounter a virus, which typically happens when we're younger, we have more symptoms. The next time we are exposed to that virus or a very similar virus, someone who has a well-functioning immune system tends to have fewer symptoms because of the way our immune system has adapted to the exposure to that virus in the past. That's why kids always run around with like coughs, sneezing, runny nose, a lot more than adults do. They're getting exposed to many things for the first time. Their immune system is responding in that particular way, but the next time they are exposed to that or a similar virus, they probably won't have those same noticeable symptoms. So COVID is a virus, a new virus that causes upper respiratory symptoms in most people, although there are some GI symptoms and other things we've seen. Cough, fever, runny nose. I mean, you've heard what the symptoms are by now. And this one in particular does seem to elicit a very dramatic inflammatory reaction in some people. So it causes a severe symptoms in select people, severe respiratory difficulty, and it does a unique thing, it looks like, to the hemoglobin in the red blood cells, which makes it difficult to move and transport oxygen to places it needs to be. And as we all know from like fourth grade science, we need oxygen to live.
Right.
So if you don't have adequate oxygen, then survival becomes difficult. So that's we think a somewhat unique thing about this particular virus that we haven't found in other ones.
So you talked about the immune system. You talked about, kind of strengthening that. You talked about how we come in contact with so many different viruses.
Yep. Yep.
And because this one's new, I guess there's less data and less, what do we know about it? But in light of like the immune system piece, like I guess the virus has affected different kind of classes or groups of people differently. So I have parents that are 69 and 68, fairly healthy. What should the concern level be like for them and, for me as their son? Like, they haven't seen my kids in a while and they're branching back out to that. Like, talk a little bit about that, like the risk and...
Well, hindsight's 2020, the difficulty is, maybe we've been primed by movies and books and things like that. We're all kind of expecting this sweeping pandemic to knock out a quarter of us or something. Early on, even very early on, we were getting some conflicting data about the virulence, or basically how dangerous this virus is, how contagious is it, how likely is it that if you get it, you're going to have severe symptoms and wind up in the hospital or worse. And I think out of appropriate caution early on, we just protect everyone. And in general, as we age, our immune systems wane, they decline some, we're more susceptible to infections.
Sure.
Most people, if they don't die of cancer or heart disease, are probably going to die of an upper respiratory infection at some point in their life. That's just what's gonna send them on. So at this point, 3 months out, we've been able to better categorize people into high and low risk groups. And one of the concerns was early on, we were looking at these places around the country where we had nursing homes and seeing a high rate of bad infection. People ended up needing to go to the hospital or dying. So a lot of the folks that were succumbing to this virus were in nursing homes, which kind of perked us up and say, oh, well, it seems like the elderly are particularly vulnerable to this. And you mentioned your kids not being able to see their grandparents. We also wondered if kids were just fountains of viral spread.
Carrying it.
Yeah, just And unfortunately,
Here comes COVID.
yeah, right. There's even places in the country where if you're under 16, you're not allowed in. Like, some of that came from good research. Some of it came from terrible research and hysteria and media frenzy. So the answer is now we can look back on the 3 or 4 or 5 or 6 months of experience we have with this and say, okay, we're a little bit more able to determine who is susceptible to it and how to mitigate some of those susceptibilities.
Talk to me about, again, along the vein of this immune system and like keeping that strong. There's this thought process like, I have to worry less about outside intruders if I'm taking care of my inside defense, aka my immune system. So what are some things that you recommend as ways to strengthen our immune system, things that we need to be doing or having or taking?
Sure, yeah. So paradoxically, one of the best ways to strengthen your immune system is to not be anxious, not worry, right? But we're worried. But we're worried about it. So it's difficult, but it is one of the best ways. So worry raises cortisol levels, which suppress many different aspects of your immune system.
So worry has some cousins, right? Like, and fear's one of them, right? Yeah. So that's kind of can be affecting.
Sure. Yeah. I mean, and
cortisol.
Yeah. So keeping cortisol levels well managed is a great way to. Most people have been through a time in their life where they've had anxiety, worry, financial troubles, poor sleep, and then boom, on the tail of that, they get sick, right? So that's it happens. So that's number one, worry. The second one is, like literally being outside in nature, in the sunshine, in fresh air, getting adequate vitamin D is amazing. So we're really doing a bad job from a public health standpoint of managing people's risk of getting coronavirus by telling them to stay inside and worry, right? So it's not great public health advice if you don't want to get sick. In fact, reports have come out from New York City within the last few weeks that people that are staying inside, supposedly isolated, are some of the people that are the highest risk of contracting symptomatic coronavirus.
Wow.
It's kind of inexplicable in a way. How did they get it? But they're doing the exact opposite of what most people would say you need to do to keep your immune system
strong.
Yeah.
Wow. What about from like a standpoint of like vitamin C, zinc? I'm just talking like I know what I'm talking about, but I've heard you say a few things before.
Yeah, okay. So again, just caveat: don't take these things unless you talk to your doctor.
100%.
I'm your doctor, so
I
tell you what I would tell you to do. So supplemental. So vitamin D, number one, I mentioned a second ago.
Get out in the sun. It's free.
Get out in the sun. Free immune support. Vitamin D is a little bit mislabeled as a vitamin. It's a hormone. It affects it affects your genes. It affects your DNA. Turns on and off hundreds, if not thousands, of portions of DNA to support your immune system and other many important functions. In fact, it's so important, frequently right now. But basically, there is a direct correlation between your likelihood of getting very sick or dying from coronavirus and your vitamin D levels. So higher vitamin D equals much lower risk of getting this. And this is sadly why some of our minority populations seem to be susceptible. The darker your skin, the harder it is to be out in the sun enough to influence your vitamin D levels. So you've got a sort of so ancestrally speaking, the darker skin, you tend to be from somewhere in the world that has more sunshine, and you tend to be out in it more.
Right.
So year-round sunshine on the equator, you're getting 12 hours of year-round sunshine. You need to have darker skin, or your skin will fry. But also need to be out in the sun more to get your vitamin D up to a healthy level.
So what is that very, very practical linear mind here, like per week? Like if I was going to say, I need to be out in the sun.
So a fair-skinned person needs to be out in the sun for 30 minutes to 60 minutes per day. It depends a little bit on how much of your skin is exposed, etc. So I say eat lunch outside. Easy, right? Sit outside. If you can take your shirt off, wear shorts, eat lunch outside.
That's so great.
Yeah. Now, if you're darker skinned, you probably need to be outside more.
Okay.
And the nice thing is I check a vitamin D level in pretty much every patient. It's a cheap test. If it's too low, you can get outside in the sun, or you can eat some foods or take a vitamin D supplement. So that's number one, vitamin D. Vitamin C seems to be very helpful as well. Zinc, as you mentioned, seems to be helpful. There's a few herbs that seem to be very helpful too. And honestly, I think if people are doing those 4 or 5 things, you're going to be very well protected.
So good.
Yeah.
Talk to me a little bit about what masks do, what they should do.
Yeah. So it seems like right now there's the mask controversy is just
Polarizing.
Is polarizing. It's like, anything from if you do not wear a mask, you don't care about people. Like you kind of want people to die.
Right.
If you don't wear a mask,
right.
Like you're sadistic. And then there's people that if you wear a mask, you're trying to terrorize me and my family. So I don't think those are typically the case.
100%.
But that's kind of where the camps tend to be right now. There is not a lot of research on mask use, to be honest. I've looked. There's a few articles that have tested, cloth versus the more the surgical masks versus everyone's heard of an N95 respirator type mask. There's a few decent research articles on them that suggest that looser fitting masks don't do a lot to prevent the spread of most viruses. So one mistake that people who are against wearing masks make, and then they need to stop it, is to say that the size of a virus is this big, and the pore in a mask is bigger than that. So therefore, the mask can't prevent the virus. That's actually not true. That's not how viruses typically. You don't cough out one virus and it goes. You cough out a droplet of fluid from your mouth, which contains many viruses, and the fluid droplets are bigger than the holes in masks.
Gotcha.
So it's a bad comparison. But if you have a mask on and you cough, it's a loose-fitting mask, and you cough, you're not likely to direct any droplets straight forward. That's why we don't cough on, we just don't cough on people. When we teach our kids from the time they're young, don't cough on your brother, right?
Right.
When we do the Dracula cough or whatever, or sneeze or something like that. That's sort of been courtesy for a long time, for good reason. Now, so I do think there is some value if you're sick, coughing, are likely to spread the virus, and then that's a whole other question, who's likely to spread the virus. But certainly, historically, if you've been sick, coughing, sneezing, you need to not do that on other people. And I don't think that's controversial.
Right, not at all.
Beyond that, it's really conjecture. Do masks prevent the spread of this? It's not been proven. Now, okay, so that's spreading. Now, getting the virus. Does a mask help you not get the virus? A loose-fitting cloth or surgical mask is not going to minimize your inhalation of anything, essentially. In order for a mask to keep you from getting anything, the test that we do in hospital to see if a mask will do that is we put a mask on you and make sure it fits well, and then we vaporize like a sweetener or some flavor in the air. And if you can taste that, your mask does not fit well. And so that's actually a test you can do at home. Put your mask on, spritz some something like powdered sugar, Febreze, anything that would have an odor to it, because that odor, that chemical's traveling in a particle, an aerosolized particle that you then breathe in. If you can smell it, you're not preventing a virus from getting in. Now, are you preventing 10% of the virus from getting in by having a mask? Maybe. We just don't know. So it's not likely to be super helpful to wear a loose-fitting cloth mask to prevent yourself from getting a virus. It's just not that likely. It just hasn't shown out. Now, I think another point to address at some point is, what does it say socially to wear a mask? And I've heard people say, yes, and yes, I see that the likelihood of me actually doing anything useful is not that high, but I'm going to do it to love people and to show that I'm concerned. I'm willing to make this concession to put people at ease. And I think there's some, I respect that. I think there's some value to that.
Sure.
What would Jesus do? I don't know. Would he wear a mask? I don't know. It's an interesting question, I guess. But the science is as I laid out.
Okay.
Yeah.
What about most recent? This people will be watching this, and this week it's come out that the WHO released that asymptomatic people, that it's rare that they are, I guess, contagious. I don't know if that's the right word, or spread the virus. Yeah. When on one hand, it seems like that's part of what shut everything down.
Yeah, that was the biggest fear, right?
And so now it's like,
oops.
Yeah. So, what is your take on that? I don't know. Or was there a camp of medical professionals all along that said, "Listen, I don't know. I think maybe that's not realistic anyway." I don't.
Well, yeah. So the World Health Organization, I guess 2 days ago, made something public, and a particular member of it, I guess, she came out and said, it actually doesn't seem that likely that asymptomatic, so people without the fever, cough, shortness, are transmitting the virus, which again is kind of the reason we shut everything down for 3 months.
Right.
So I think a bigger issue is, the World Health Organization, should they be influencing our policy? I'm not sure about that. We certainly didn't elect them. I have some concerns just about the organization. And really, an organization is a group of people, right? A group of human beings who may or may not all agree themselves. They're certainly flawed, sinful, prone to bias and agenda, and whether they know it or not, and certainly capable of making mistakes.
Sure.
And I think, to me, that underscores the essential practice of making decisions locally. So, yes, if I lived in New York City, or I was living in a nursing home, or I lived in Wuhan, China, I might make different decisions for me and my family.
Sure.
I might make sure we all had good-fitting masks when we went out.
Right.
I may not go out, but we live here. And the few cases, I've been doing this. I've been asking people, do you know anyone who has for sure had coronavirus? And most people say, actually, no. Or maybe a neighbor had it a few months ago. They coughed for a while, and they kind of got over it, and we're not sure.
Right.
So that's what's going on here for whatever reason. And I'm thankful. I'm grateful. So it's troubling that the World Health Organization or the CDC or New York or the mayor of some other giant city is dictating policy that so dramatically can adversely affect things here when the risk doesn't apply here.
Right.
So I think, anyway, it just makes the case for local decision making, I think.
100%.
Yeah.
What about CDC guidelines and the social distancing thing. Like, obviously we talk about keeping our immune system robust and strong by, when we're worried, when we're not in the sun, or about how that affects and hinders what we're doing.
Yeah.
But, so even the social distancing piece of it, like,
Sure. Yeah.
where's not the value, but like, the value.
Sure. Yeah. Well, I mean, so again, it's nice to have everyone. Everybody is biased. I'm biased. I try to be conscious of what they are. Again, CDC is a human, flawed organization of people who are prone to making mistakes. Sometimes they get things right. Sometimes it's very helpful what they say.
Sure.
Sometimes it's wrong.
Yeah.
I mean, show me an infallible organization. There's not one.
Right.
So I've encouraged my patients and the people I talk to, apply wisdom to the evidence you're hearing. What's the source of the evidence? Who's it coming from? Are they trustworthy? What's their agenda? What is their bias? And use that and apply wisdom to it. And so if you look for the science to say you need to stay 3 or 5 or 6 or 10 feet away from somebody, it satisfies a part of us sort of intuitively to say, if you're sick, I need to stay away from you. I mean, again, that's not new information.
Right.
I've isolated sick people from the beginning, like from the we talk about doing that in the Old Testament. People that are sick, you stick them over here for a while.
Right.
That's fine. So no one has ever argued, should sick people stay away from well people? The trouble came up with the potential asymptomatic spread, which again, thankfully hasn't borne out. But if you look at the studies showing the value of human contact for health, dozens and dozens, if not more. What does a hug do to someone's immune system? What does daily touching of a person do to the hormones in their body and the things that the feeling of well-being, holding hands and going for a walk with somebody in the park, right?
So God knew what he was doing.
God knew what he was doing. Like oxytocin is a hormone released when people touch each other, when a baby touches the mom, when a husband and wife touch each other, when someone you love hugs you. I mean, the profound health impact that had. I mean, public health policy should be give 3 hugs today to someone. I mean, blood pressure would go down, diabetes would go down, heart disease would go down, immune function would improve, people would be sick less. So, again, if you want to make a list of things to do to be unwell, don't go outside, worry, and don't touch anyone, right? So.
Wow. I got one final question, maybe 2. Okay, so you know how pastors are, like,
Yes.
I'm closing,
Right.
and that's a hard thing.
Yeah.
Thinking about the possibility of, the fall, some type of resurgence or whatever, that in light of the idea of reentry, because there's this part of me that's like, okay, even from just the conversation today, you as my medical doctor, I don't care what anybody else does.
Right.
I know what I should do.
Yeah.
I should get outside.
Yeah.
I should, hug somebody.
Yeah.
I should not worry.
Right.
I mean, that's being health focused and not sick focused.
Mm-hmm.
And there's been such this awareness of avoid this, and in the midst of avoiding it, you're focused on it.
Right.
Rather than, how can the target of our lives be health?
Mm-hmm.
And push that way and let that take care of some of the other things. Doesn't mean I'm going to be bulletproof,
Right.
but my life might be better.
Yeah.
And so as we think about reentry, how do we do that? What, from your standpoint, and then, like, what is the validity of, because there's some people that are already worried about the fall.
Yeah.
And that's already a weakening their immune system.
Sure.
So maybe just talk a little bit about that.
Sure. As with the flu and many colds, and it looks like even this, I mean, so practically talk to your doctor, see what your vitamin D level is, see if you can get on, a vitamin C regimen, see if there's a few simple, harmless things you can do. Talk to your doctor about that. It's not a bad idea. I think that as a church or a small community, help identify the vulnerable people. If there are some folks in your congregation, your community that are not healthy people, accommodate them as best you can. And I think it's fine to take things slow. I mean, I just think it's fine to not rush things. I've actually advocated for like wristbands or little like rings that are like color coded for your comfort level of like maybe touching someone else.
Sure.
So like if you have a green wristband, you're like, I'm good. Like,
Right.
I feel like I'm healthy enough. I'm okay to shake your hand and hug you and all that. And then maybe it's yellow. You're like, I'm still not sure. And
Right.
red, you're like, I need to really keep my distance.
Sure.
So maybe we'll market that or
Sure.
something. But I think fortunately, thankfully, we need to thank God because early on, the first couple weeks, I'm like, good grief. Like, so I'm not cavalier about this. I promise you.
Right.
The Friday this hit, someone told me the date. I don't know, March something. So Wednesday, Thursday, we started getting word of this. I reached out to some super smart people I'm in contact with, and I was like, hey, what's going on with this? And they said, this could be bad. Like, there could be dead people all over. And I was like, yikes. I was probably the first person in Spring Hill, Middle Tennessee, to voluntarily shut down my business. I called my business manager Friday. I said, shut it down. I don't know what's going to happen. I need Friday, Saturday, Sunday to figure this out.
Right.
Okay. And then the Monday is when more restrictions and policies started to be putting in place from the top down, saying, all right, you need to shut things down. So we were not being cavalier about
Right,
this.
sure.
We were being very cautious. And, I got on Facebook and with my patients, I'm like, all right, guys, we need to take this seriously. Here's what we need to be doing, telling them, what supplements to start considering, what to do, how to protect themselves. So I haven't, I don't want it to come across as I've just been like, blow this thing off from
Right,
the beginning.
sure.
I didn't know.
Right.
But we've had 3-4 months of experience and learning and trying to filter through some of the silliness about it. And, the likelihood of getting this, especially here where we live, is extremely low. The likelihood of dying from it is extremely low. I don't have a good comparison, but I would suspect, like, you probably know more people that got struck by lightning than that died of COVID around here.
Sure.
And to that point, if there was a giant thunderstorm, I wouldn't stand outside in my yard with a golf club over my head.
Sure.
I'd probably take a little shelter.
Right.
But every cloud that comes by, I'm not diving for cover
Yep.
either. So to me, all of life is trying to understand risk, mitigate it responsibly without living in anxiety, knowing that God is sovereign and in control. So that's how I'm going to approach the fall. I'm going to support my immune system. I'm going to encourage my patients to eat well, exercise, be outside, try not to worry, be in a community of people that love and support them, and read a couple books like Arthur Pink's The Sovereignty of God. God is not like he's not surprised by what's happening. He's not wringing his hands saying, "What do I do?"
I'm backed into a corner.
Oh my gosh, I didn't know this was.
Sure
going
hope
to happen.
Dr. Hutton gets it right down there.
Yes.
No.
I hope he saves all those people. So in whatever mysterious, weird way, God has known this is going to happen from all eternity. He's not surprised. I mean,
He's not scared or
he's-
worried?
he's not
How's
worried.
his cortisol level? Do you think
yeah,
it's
he's okay.
Okay, all right.
He's probably not social distancing
Okay.
either. I think he's not at all. So that's how we're going to approach the fall, as in the September, not the fall of creation, but September, October.
100%.
Yeah. So yeah. So
Awesome. Well, I mean, I think we covered the big chunks. I mean, obviously, there's so much more I think we could talk about, but I just, again, I felt my responsibility as a pastor and as a shepherd was to not be silent and to not just, hey, let's just pray this away. I'm not saying we shouldn't be praying, but let's hear from someone who, again, has a biblical background and understands those things, but also this is your lane. This is, you're a medical trained doctor, and so I just thank you personally for what you mean to our family, and then just what you've been able to share with our people.
thanks.
Thank
for
you so
having me.
much.
Yeah, it's